Are you struggling with hip pain and not sure what's causing it?
Well, today we're going to discuss a major issue that most people overlook, including therapists, on why the hip is painful.
Now, the problem we're going to discuss today is called anterior femoral glide syndrome, and we actually learned about this from our friend Rick Olderman, who is a physical therapist we work with and have even co-authored a book with as well. For more findings on him, you can go to rickolderman.com and check out his program sections and other things there.
But on this video, we're going to skip that, actually go right to it, show you what this syndrome is, and then exercises to correct it.
So for a more detailed explanation of what anterior femoral glide syndrome is, Brad's going to take over.
Yeah, I'm just going to call it AFGS because I have a hard time enunciating the full thing. We're looking at the hip right here, the ball of the hip into the socket, and anterior femoral glide. Anterior means forward on the body. So the ball of the hip actually moves forward, which can cause pain, and even more, there is something called the labrum, which is a cartilage rim, and if that labrum gets tore or irritated, that can even cause more pain and really a syndrome that you want to avoid. So we need to figure out how to strengthen the muscles in the back to pull the ball of the hip back where it belongs in the joint so it's stable, eliminating the irritation and the pain. Okay, so here the hip is in anterior position, in other words, forward, like I had mentioned. We need to mobilize or bring it back. So if I were to take this belt around the femur and pull it this way to bring it back, that would be a good thing, and then we need to maintain it there. We're going to show you how this is done, and it's amazing how it's similar to exactly what I've just did here. Go ahead, Mike.
So to perform this mobilization, you can use a belt like that. You're going to need to wrap it around something sturdy, whether it's a stair railing, bedpost, heavy kitchen table, whatever can hold your weight. You can also use a loop band like we have here. Now there's more stretch to this, so I need to pull the slack out of it. But what we're going to do is you're going to get it roughly in the crease of your groin here. And I like to hold on to it because sometimes it can drop. You don't have to, whatever works for your body. I find thicker bands work a little bit better. Again, with the belt, it's fine. You're just going to be closer. So once you get in this position, simply go forward. Almost, you're not going to do a full lunge, but just kind of slightly lunge forward. This is going to help pull that femur head back into place and get it out of that anterior lock position. With the belt, you're not going to have this amount of play to move forward. So just go by feel. Just do a few reps. Some people, you may actually kind of feel it pop back a little bit. That's a good thing. It's kind of getting back into place.